The psychology of COVID-19, building resilience for future pandemics. This is your last chance. After this, there's no turning back. You take the blue pill, the story ends, and you wake up in your bed and believe whatever you want to believe. You take the red pill and you stay in Wonderland, and I show you how deep the rabbit hole goes. Remember, all I'm offering is the truth, nothing more. This is a citation from the Matrix. And are you ready to get the red pill in this presentation? Because I want to show you how deep the rabbit hole of the psychology of the COVID-19 pandemic goes. What I will be showing you is how a lot of us, we have been told all the time about the certainties in science. And our politicians, they look very certain. Our media look very certain. And we've been told how we should interpret everything. And also it seems that the mental health has a very clear-cut impact. And also we've been told about certainties in our life. However, when we start to look asking questions, when we start to look behind all the certainties, there seems to be a lot of uncertainties. And these are the uncertainties of science, uncertainties of politics, of the media, uncertainties of how to interpret the pandemic, the uncertainties of mental health and uncertainties in life. Because this is what I'm questioning in this presentation. We're being told that there's a new normal, and that this is a new normal that we should learn to live with. But is it normal? And should we learn to live with it? Or is it actually a new abnormal that we should possibly not want to live with? So what I'm talking about in this presentation is very much about how most of us, most of ordinary people who live their daily lives and who are not necessarily part of governments or science, a lot of us, we depend for opinions on what we hear in the media, what we hear from the governments, what we hear from the ministries. But unfortunately, when it's about the COVID-19 pandemic, there's a lot of doublespeak going on. In a similar way as George Orwell was talking about that in his infamous book 1984. And in this presentation I will show how there seems to be going on a little bit of this 1984 doublespeak. And this is where psychology comes in. Because it's all the time that our psychology gets manipulated. It gets manipulated by governments, by scientists, by the big pharma. And this is the psychological impact that really directly influences our daily lives, the decisions we make, our behavior, whether we follow all the guidelines about social distancing, about using all the mouth masks. But it also has an impact on how we feel about ourselves, the anxieties we experience, our traumas, our mental health. So we're not talking here about any theories, we're talking about the actual reality of the daily lives of people. Let me start with giving you some examples. Because if I would be hearing such an opening of a presentation from anyone else, I would be skeptical. I would be like, okay, these are big words, but what do you precisely mean? I will show you that with 3 examples, and after that I will go into much more detail in how all those mechanisms work and how our psychology, how our psyche gets manipulated all the time. And from there I hope in this presentation that I can also show how we could overcome all these manipulation and how we can become resilient for future pandemics. But let's start with the first example. A first example of where we are being told certain certainties and how we hear about what we should see as the new normal, was actually we should question whether this is all certain and whether this is a new normal that we should accept. So this first example is about a lot of the governments telling us we are in this together. But are we? Are we really in this together? Let's have a look. Who are the people who are profiting from the pandemic? Just some very tiny examples. Some months ago, I read this citation in a journal. It was saying, "Give your portfolio a shot in the arm by investing in the shares of the companies working to beat coronavirus." And we know by now that some of the shares of some of the pharmaceutical companies, they've gone like 500%, 1000%, or even more than that over their initial value. So the shareholders have become rich, very rich over this vaccination. And if each person in the world were vaccinated, this would be about $133 billion gross. And that's approximately 30% of the annual income of the big pharma. And of course, we've heard now that people do not only need one vaccination, they need two to be able to really be immune against the virus. So that means actually that almost 25% of the annual income of the big pharma has been added. And then there's also some rumors that we may need to get 2 of those vaccinations each year, which means that big pharma has been really earning a lot from this. Also, what we see is that the big pharma in the United States have increased their lobbying expenditures only in the first 6 months of the pandemic in 2020 by $248 million. And there have been more than 357 new lobbyist registrations. Just bear that in mind when you think about the so-called independence from our civil servants and our governments in making decisions about the pandemic and how to deal with it. So this is one side of the coin. These are the certainties that we have been told about how good the vaccinations are. But let's look at the other side. At the other side, we see that a super syndemic is going on. A super syndemic, that's the term that is used to describe the combination, the interaction of a medical pandemic combined with other factors. So that's the interaction or the synergy between health and wealth. Let me give you some examples. We see that people with a lower socioeconomic status, they're more likely to develop COVID-19. And if they do, they also develop more severe symptoms. And this is unfortunately an international trend. We also see that people with a lower socioeconomic status, they're also more likely to work in high-risk situations. So then we talk about the nurses, the doctors, but also we talk about people working in supermarkets, the bin men. So all those people, they are exposed to the virus on a daily basis. What we also see is that people with a low socioeconomic status, they're more likely to live in small, overcrowded housing, where a virus is much quicker spread. And it's also more likely that people with a lower socioeconomic status, that they eat less vitamin-rich food and that they experience greater stress, which both contribute to a worse immune system and a higher risk of developing COVID-19 and other viruses. What we also see is that already during 2020, we've seen that approximately 36 million people in the United States have become unemployed. And 6 million people have become unemployed in the UK. We also see that a lot of the employment laws have been changing, have become more flexible, so that actually there can be bigger demands from employees and employees can be fired quicker. And there's also a big appeal towards replacing employees with robots and other types of automation, because robots are not infected by viruses. Okay, computer viruses, but not by virus like COVID-19. So robots and automation are much more reliable for big employers. But obviously this has a big impact on people who are usually doing manual work. And also what we see is that there's a big interaction also with ethnicity. For instance, it's very clear that in the United States, that almost all of the American kids and teenagers who have died from COVID-19, they were Hispanic and black. And this is a trend that we see almost internationally, where it's mainly the ethnic minorities who've become severely ill with COVID. And we also see how there's big global inequality, where it's mainly the most unequal Western countries that they are hit the hardest. And within those countries, it's the poor who are hit the hardest. So, for example, we see that the highest numbers of infections and COVID deaths are the United Kingdom and the United States. And these are precisely the countries who are the most unequal Western countries on earth. And within those countries, individuals who got hit the hardest are the poor. So what we see is very much that from this side, that the pandemic is totally unequal. And so ask yourself, think again, are we in this together? Are we? We're being told about that all the time, that we are in it together. But are we really? The risks that you are having yourself, the impact on your life, is that the same as your neighbor? Have a think. So this is one of those myths. This is just one of those examples of how we've been told certainties, certain myths almost, whereas reality seems to be more complex. A second example is about the vaccinations. It's very likely that what I'm going to say now will trigger some individuals because there's so much pressure on the importance of the vaccinations. The vaccinations have become a symbol of hope. And people really are desperately clasping onto the certainties that governments and scientists are giving about the vaccinations. And a lot of individuals do not want to hear any uncertainties. However, when you read these scientific articles about those clinical trials, about those vaccinations, for instance, the Pfizer and Moderna trials, or the AstraZeneca, the Oxford trials, what we see is, yes, it may give a slimmer of hope. And it can help, potentially. But there's still so much that we need to find out about those vaccinations. I'm not saying that this is not an option at all, that this is a way we shouldn't go at all. No, vaccinations can help. Possibly. But we don't know enough about it yet. Possibly. You need to make your own decisions. That's of course important. You need to make up your own mind. But think about it. What information have you received from governments and scientists? What are the social pressures, the peer pressures? Or what's the pressure even from companies or restaurants who are saying that they will only open for people when they can show that they have had a vaccination? So there's a lot of pressure on the vaccinations as a symbol of hope, and possibly less as the reality. Because what we see is that the Pfizer and Moderna trials, that actually they've mainly focused on healthy individuals. And also we see that they mainly report the relative effects. They say that that is like 95% or 94%. But they do not present absolute effects. This is quite an important bit because I do not necessarily want to know for myself whether I'm doing better than my neighbor, but I want to know whether I'm doing better, really absolutely, in an absolute sense, not only in like a comparison with neighbors. And when you look at the absolute effects of those vaccinations, we see small to moderate effect sizes, but not large. So just by selecting the right statistics, the statisticians can say, hey, look, this is a great vaccination trial. Also be aware that those vaccinations, they do not give immunity. They do not say anything about getting or not getting the virus. They just say that you have less severe symptoms and that actually people who receive the vaccination are less likely to have such severe symptoms that they need to get another COVID test to get it confirmed. So what you see is the trials are mainly saying that you get the symptoms less severe. Which is still, of course, a good thing. When you don't die from COVID, yes, of course, that's my preference. And of course, it will also help the National Health Services on a large scale because it will save many beds in the ICUs. But also, the COVID-19 trials, they've not looked at the transmission of the virus at all. There's no long-term observations about how well this vaccination works, for instance, against new mutations. There's little information on the long-term effects, for instance, on the effects on fertility. And even the national government of the United Kingdom has said that it's not appropriate to give it to pregnant women, because we don't know any long-term effects yet. Possibly the most important is that this is a new type of vaccination which have never been successfully implemented before. Because it's a new type. The traditional type of vaccinations, as you will possibly know, they give you a small bit of the virus and that will trigger you to create antibodies. But this is the so-called mRNA type of vaccination. And that means that it makes like a genetic change within your body, which gives a spike, which will hopefully create antibodies. In theory, on paper, it looks perfect, but this has never been implemented on a large scale. We do also not know what the long-term effects of those genetic changes will be, because those changes may be irreversible, and we don't know what other side effects they may have. It's also intriguing that although SARS-CoV-1, the first SARS pandemic, has been now many years ago, more than a decade, and they've tried to create an effective vaccine, but they've not been able to identify any effective vaccination. And then 2 months after the emergence of COVID-19, suddenly several pharmaceutical companies were able to identify a good way to create a vaccination. Surprise, surprise. It's also fascinating how the EU has lowered the criteria under which they accept new vaccinations. It's also interesting to see that manufacturers are not liable for any side effects or deaths that emerge or occur due to the vaccinations. Because it's the governments who are paying for any side effects or deaths. And so, for instance, the United Kingdom has prepared themselves for several millions of cases of severe side effects of death, as they've ordered millions of test kits for the side effects and deaths due to the COVID-19 pandemic. Which does not give a lot of hope, I have to admit. So several doctors have said that they are not sure whether it's ethical to give this vaccination to everyone without giving all this information. Giving this vaccination may still be one of our best options, could be. But what's important is that people make the decision themselves on the basis of full information. People should be able to give their informed consent. So some critical medical doctors are saying that the rolling out of this vaccination scheme and the very much positive publication around it, and that's actually violating the Nuremberg Code, which we decided upon as world after the Second World War. Because this Nuremberg Code is saying that we should not do any experiments on human beings when they are not able to give their informed consent. So what we see here is we're being told one story. We're being told the story, yes, a vaccination will give the hope. It's the end of the pandemic. But just on the basis of the clinical trials, and I'm just citing the clinical trials themselves, just on the basis of looking what they tell, it's unlikely that the full pandemic will stop merely by vaccinating everyone. That's very unlikely. So this is a symbol of hope and it's not reality. But a lot of people, they think it is a reality. So, and I will speak about it later in this presentation. Why do we start conflating such a symbol of hope with reality? Of course, another example of this is, of course, the lockdowns. And when we talk about lockdowns, the big question is the cure worse than the disease? Or, as the joke goes, the surgery was successful, but the patient has died. So what we see is, for instance, that the Office of National Statistics is saying that for each 2 or 3 COVID deaths, there's at least 1 death due to the immediate effects of the lockdown. For instance, due to the lockdown, a lot of the non-urgent hospital appointments have been cancelled, such as people are missing their cancer checkups. Their cancer surgeries get postponed. So at least 40,000 people have died during the lockdowns due to the fact that we're having a lockdown. And also what we see is that worldwide there are approximately 500,000 more extra suicides on top of the usual numbers of suicides. And those 500,000 extra suicides are the direct result from the lockdowns. Because the lockdowns, they create a lot of stress. They create a lot of uncertainties about jobs. People lose their jobs. And it's precisely this that make a lot of people go to the most worst situation in the mental health. And put it in perspective, there have been 2 million COVID deaths. And there are 500,000 extra people who have killed themselves due to the lockdown. And so, this is also one of the reasons why the WHO, the World Health Organization, the most important body in giving advice on how to cope with the pandemic, the WHO has advised against large-scale lockdowns. Yes, the WHO has said that a lockdown can work in the early stage of a pandemic, because that is when people or a country or the hospitals need to prepare themselves for what's coming to come. Also on a local level, we know that local small-scale lockdowns can work to prevent people from spreading the virus. But there's been no real clear evidence that large-scale lockdowns work. Also before the pandemic, there was never a consensus that lockdowns would work. All the consensus amongst epidemiologists was against lockdowns. And a lot of research has been showing actually that lockdowns, for instance during the first SARS pandemic, more than a decade ago, that those lockdowns have had negative effects. One of the main epidemiologists and virologists in the United Kingdom is Niall Ferguson. At least Ferguson has had a lot of influence. On the basis of his academic work, did the United Kingdom, but also the United States, decide to go into large-scale lockdowns? Because he had predicted that there would be more than 300,000 deaths if there would not have been a lockdown. So, of course, when you're Boris Johnson or when you're President Trump, then you think, oh, I want to prevent so many deaths. Let's do a lockdown. That's understandable. But only a week later, Ferguson said in the media, well, possibly I've overestimated it. It's more like 50,000 deaths. And like a month later or 2 months later, he came and he said, well, I think it will be more like 20,000. So that's intriguing. And this is also what Ferguson, when he was asked by a COVID-19 committee in the House of Lords, when he was asked what was going on there, he said, well, a lot of the information, a lot of those numbers, those figures, is based on uncertainties. They are just theoretical expectations, estimations. But we don't know for certain. There's so much uncertainty. And we need to continuously adjust our models. And possibly, there's not real evidence that our lockdown has helped. And that it is better than the situation in which we would have not had a lockdown. So you even see that the main person on whose advice the country decided to go in a lockdown has later said that possibly lockdown was possibly not effective and was not a good idea. And similarly, what we see is that there is often a lot of people who have an argument, or they're saying, well, you know, I know why the lockdown has never worked. Because lockdown has never been properly done before. Because not everyone is sticking to it. Like, look at that person over there. That person is still going out. The person is partying. So it's due to the party goers. It's due to those individual citizens who have been bad behaving. And that is why it didn't work. So the idea of the lockdown is great. But people should adhere to it. This argument, the logics behind it, there's something wrong. Because the logical structure of this argument is the same as the lockdown did not work because I have not been wearing my tinfoil hat. So in future, if I want the lockdown to work, I need to be wearing my tinfoil hat. It is precisely the same logical structure. So this does not seem to be a strong argument. And it seems that we need to start asking questions about the lockdown. However, When we look at the media, we're being told all the time about let's go in a lockdown, let's stick to it, this is the solution. Together with all the vaccinations, we will get over it as long as we have a good lockdown and everyone gets vaccinated and heaven will be on earth and everything will be good and we will all be living happily ever after. But this is not true. It's very unlikely. But a lot of people believe this. And this is where the psychology of COVID-19 comes in. And this is where psychology gets all the time manipulated. And this is the main message in this presentation. That is about how the uncertainties of the reality of real science, how the uncertainties in politics, uncertainties that journalists deal with, uncertainties of how to interpret the situation, and uncertainties about mental health, and uncertainties in life, how they get all changed as like in a meat mincing machine, and how that all is changed into so-called certainties of science, certainties of politics, the certainties of the words of the journalists, the certainties of what we're told, how we should interpret the situation, and the certainties about mental health and about life. And this, what happens in between the uncertainties of the reality and the certainties that we seem to be believing in, what happens there in between, that's the psychology. And this is what this presentation is about. And I will now be going systematically through the uncertainties that we face in science, that we see in politics and journalism, and how to interpret it in mental health. And finally, possibly the most important, is how do we cope with uncertainties in life? And how do we change those uncertainties and certainties? Why is it so difficult for us to live with those uncertainties? I will already start with my key message. Because at this moment, the only certainty that we're facing is uncertainty. There's so much we don't know about the COVID-19 virus and about how to deal with the pandemic. But people want certainty, and people will only hear certainty. Because they want to hear it, then they will hear it. It's the only thing they pay attention to. But the problem is that those false certainties, they pressure people, they kill. And I will give many examples of that. I'm not only talking about the suicides, I'm also talking about the impact on the economy. I'm talking about the impact of closing down many other departments in hospitals. False certainties are dangerous. And therefore, I'm saying let uncertainties be uncertain. And also let the certainties be certain. Because what we're now actually seeing, what we are experiencing, is a reality which is complex, which is dynamic, with loads of uncertainties. Yes, there's some certainties. And it's important to address both and not to create in ourselves this very fake, false idea that we live in a world full of certainties. No, reality is complex. It's not black or white, it's all shades of grey. So the first domain that I will be talking about is science. And science is full of uncertainties. And of course, when we now listen to scientists, we hope to hear from them some uncertainties, because wouldn't that be wonderful if they would find the magic solution which will prevent all viruses and will help us to go back to our normal daily lives within a second? That would be brilliant. But unfortunately, our scientists, they are not like magical people. They're just human beings. And particularly science during a pandemic is not normal science. And this is also what Abhi Singh is saying. Abhi Singh is a person who has done some research on how people usually cope with pandemics and how science during pandemics work. And Abhi Singh is saying, science during a pandemic reflects the transition between normal science and the post-normal form of managing risk. Because what's happening during pandemic? During pandemic, there's a new virus. And very quickly, it's important to identify what is precisely the virus, where can we find it in the RNA or the DNA, which variations are there, which mutations, how large is the transmissibility, how fatal is it? So there are a lot of information that needs to be concluded very quickly. And then on the basis of that information, scientists need to make some recommendations for the management of those risks. But quite often, the full data, there's so many estimates that actually it's really almost impossible to give any recommendations. Like for instance, Ferguson, when he was recommending to go into a lockdown, he was estimating hundreds of thousands of deaths. But actually later he admitted that that was an overestimation. It's really difficult to do science during a pandemic. And also it's important that what scientists and what citizens expect from scientists may not be the same as what scientists can actually offer. And that's a citation from Dobson, who says, "Scientists do not really do certainty. All of science is based around the models that we construct to tell us about the things we are interested in, and the experiments that we conduct to see whether the models match the reality on the ground. It is this combination of model experiment, trial and error and correction that help us understand the world." So scientists rarely give a black or white answer, that is say, okay, this pandemic is really bad, like everyone will die if they get a virus. No, it's more about likelihood. It is statistics. It is not black or white. And that is the thing. It's complex. And also about like vaccinations, you need many trials, many errors on the long term. And that's not something you can do with like a clinical trial on vaccination only half a year time. It takes a long time, long experimentation. And yeah, sometimes we need to take risks, but it's important that we're honest about those risks. Yes, it may be a good idea to have the vaccinations. That may help. But let's be honest about the risks and not put all of that aside. Because those risks that are really there, they are real. And that's also what the scientists would tell if you would ask them themselves. But it's what scientists, it's actually what politicians and what citizens, what the public opinion seems to make of those vaccinations. So what we see is that there are several problems in the collection of data during the COVID-19 pandemic. The first one is that there are many unknowns. Like what I'm saying, we don't precisely know how the virus will behave. And a lot of those things are estimations. And also what we see is a lot of the data collection and a lot of the data storage. For instance, think about an ordinary hospital, how they record their deaths. That was like quite new. So they had to set up huge new data systems. And a lot of those scientists and a lot of those researchers and a lot of those data analysts, they had to learn on the job. And so we see that there have been quite a lot of mistakes, which have also been admitted. And also very important is when we look at the PCR tests. So the PCR tests are the tests that are seen as the most reliable, most valid, to say whether a person has COVID-19 or not. However, they have a low specificity and a low sensitivity. So by that I mean that they do not always detect whether a person really has COVID. And quite often we see that there are some false positives. And that means that the test tells that the person has COVID, whereas actually they do not actually have COVID. For instance, even the Dutch government is saying that 4 or 5% of all the PCR test results are false positives. The American CDC, the Center for Disease Control, is also saying that possibly even more than that, like possibly 10 or 20% of all PCR test results are not reliable. And even the WHO, the World Health Organization, has told in the second week of January 2021 that one PCR test cannot be relied upon because we need at least 2 separate PCR tests in combination with a full medical analysis or examination. Only in that way you can create a holistic diagnosis and you can say this person seems to have COVID. But even then, we're not saying this person has 100% sure COVID. medical doctors can only say it's most likely this person has COVID. And this is a very important point, because it means that there's a lot in the data that is not totally reliable. And so we've seen that there have been many problems in the collection of data. For instance, particularly at the start of the pandemic, there were not enough PCR tests. And so it was only when people presented themselves with symptoms that looked at COVID-19 that those individuals were actually recorded in the systems as having COVID. And interestingly enough, whereas usually a lot of people, they get diagnosed with the seasonal flu, suddenly this year, almost no one seems to be diagnosed with the seasonal flu, which is surprising. So it's quite likely that some of these people who actually had a seasonal flu were wrongly diagnosed with COVID. And what we also see is that some scientists, some researchers, they have been looking at the so-called excess deaths. And these are the numbers of people who have died more in this year compared to previous years. But the problem is we don't know whether those people have died from COVID or whether they, for instance, died from the lockdown and possibly from the side effect from vaccinations or even the side effect from PCR tests. We do not know. So again, there are a lot of uncertainties there. I'm not saying that there's nothing going on. I'm not saying there's no pandemic. I'm not saying that there's not a virus that we should be careful about. But we need to be clear about the uncertainties that are surrounding. And it seems that the public narrative is putting aside all those questions around uncertainty. And this is also what I already said. It's about mortality figures. So the big question is, are they due to COVID? Or are they due to the measures, our responses? Also, another problem is that the track and trace system in the United Kingdom, they have been set up by friends of the government. So what we know is that research is showing how if you want to track and trace people, so for instance to record where a person has been and if they've been in touch with a person with COVID, that they can be contacted and that they can be asked to stay at home, do a COVID test, etc. We know from a lot of research, international research, that a track and trace system works the best when you do it on a local basis. For instance, the local council should do that. However, the UK, as one of the few countries worldwide, decided to build a national track and trace system. And actually, the companies who are currently running those track and trace systems, they've never developed such track and trace systems, and they have no experience on public health. There's only one public health person on the board, and it seems that a lot of the system is failing. At certain points in time, it was 50-75% of people who were not correct. So what we start to see is that science is often biased, and that actually scientists are not so neutral as we would love them to be. And actually a lot of these scientific uncertainties get very much intertwined with uncertainties about the government. And the most relevant bit to explain here is the financial dependency of scientists, of researchers. Because what we see is that there are researchers working, for instance, at universities. Well, they often depend on the pharmaceutical industry to pay for their research. There's also the researchers, the scientists, who work for pharmaceutical companies directly. And there's also the scientists who get asked by governments to do some research for them. And this is an important bit because in the past, until let's say the 1990s, 2000, there were relatively independent scientists as part of the civil service, as part of government. But after that, the government, they've kicked out the scientists from any influence. And instead of that, what's done nowadays is that civil servants, they go each time for a new problem that they need some scientific advice for. They start to look around and they try to find the scientists who will most likely write a report for them, which has conclusions which will be in the favor of their policies. And if this scientist writes a report that I disagree with, they simply don't publish that report. And they have a gagging clause in the contract with the researcher, so that the researcher cannot independently publish that research. So in this way, research becomes actually like a tool for governments, and research is not independent anymore. And also it's important to start thinking about the decision-making processes in governments, not as like a linear and a rational way of weighing all the pros and cons. No, the reality is often quite messy, because it's non-optimal and it's incremental decisions, where it's usually like where some individuals, they come with an idea, they start to talk with some other committees, they ask, okay, do you agree with this? And as long as there's not a strong opposition and there's some other support for it, then that solution will get voted in. And particularly when there's a pandemic and where there's a potential of a huge risk with many deaths, of course, governments need to make very quick decisions. They do not have the time and the resources to look into all these scientific bases in detail. So the governmental decision making has been non-optimal. And in this situation of non-optimal decision making and little time, little resources, then the civil servants were very happy that there were big pharma, big tech, big finance lobbyists who gave them the perfect reports, telling precisely what's going on and precisely telling them what needs to be done. That's very convenient. That's precisely what they needed. So those lobbyists have clearly had a big influence on the strategies during this pandemic. And we also see that when the WHO in March 2020, when they decided that to call what's going on in the world, to call that a pandemic, that automatically triggered many trade deals internationally. So for instance, when on 30th of March, when the WHO, the World Health Organization, when they said this is pandemic, on that day automatically the United Kingdom bought for hundreds of millions of pounds, they bought vaccinations from multiple companies, because that was already prepared. These were sleeping trade deals, which were then suddenly activated. This only becomes more questionable when you start to see that the WHO has lowered the threshold of how to define a pandemic only some years ago. Because before that, the consensus was saying, yeah, a pandemic, before we call something pandemic, it needs to have more rigorous criteria. And the WHO has actually admitted that their decision to lower the threshold of defining something as pandemic, the WHO has admitted that in that decision making, they've been influenced by pharmaceutical lobbyists. So even in such a big question, is this pandemic or is this not pandemic, that decision was very much influenced by lobbyists. And actually the WHO is refusing to publish any reason or any justification of calling it a pandemic. They're not giving information about that. Another role that we need to ask questions about is the so-called private-public partnerships, such as the Gavi, the Vaccine Alliance, which is very much like the forefront for the Bill and Melinda Gates Foundation. What we see is that these are partnerships where private interests get very much intertwined with public interests, where public money gets used by private companies and all the way around, and money gets really circulated amongst a small group of people. Okay, of course, I'm now telling the worst case scenario, but it is a place where we can ask some questions. And also what's really important is the lack of preparedness. Because what we hear all the time is save the NHS, save the National Health Services. Our hospitals, they are too full. But the problem is, yes, they are too full, but that is because the NHS was not prepared. Whereas they could have been prepared. Because already on the desks of Boris Johnson and of Theresa May and all previous prime ministers, there were big reports lying there that were telling that the NHS should be prepared. That there is a problem because they do not have enough PPE. There's not enough personal protective equipment. And there's also not enough ventilators. And also there are not good organizational plans how to deal with a crisis like a pandemic. Like even 2 years ago, there was a big stress test that's called Operation Cygnus. And then it just totally failed. If there would have been a pandemic, it was told in that stress test, loads of people would die, not necessarily due to the virus, but due to the lack of preparedness. And now we are in a situation. And what we see is, yes, certain areas in the UK, some hospitals are relatively empty, but other hospitals, they're totally overwhelmed. Because, like what I've mentioned before, we see that it's particularly certain subgroups that get particularly affected by COVID. So it's mainly certain neighborhoods, certain areas that get very badly infected. And so what we see is the NHS doesn't seem to be prepared. And there are those places where things go totally run out of hand. And this could have been totally prevented. It's a political pandemic and not only an epidemiological or a biomedical pandemic. And what we see now is that there is like a public consensus almost that it's better safe than sorry. It's better to have very extreme measures such as full nationwide lockdowns or giving people relatively uncertain and risky vaccinations. It's better to do that than to be sorry later. Better safe than sorry. We cannot accept any risks anymore. Well, that's weird. Well, we actually come from a situation where we could have been prepared. This could have all been prevented, or at least for a bit. But suddenly we're now in the situation of better safe than sorry. And what we see is when governments and NHS services, when they are prepared, they're only prepared for the worst case scenario. So, for example, many governments and many health services, their worst case scenarios, literally all the protocols, they were about bioterrorism, which will be conducted with a SARS-like virus that would be used as a bioterrorist weapon that would be very transmittable and would be very fatal. But then suddenly the health services are confronted with a relatively mild pandemic, which is not so much transmissible and where the fatality is only slightly higher or even similar to the seasonal flu. And there have not been any scenarios or any protocols written for that because they've been mainly prepared for the worst case scenario. So what you see is that a lot of governments and a lot of health services are also overacting now. So what's going on here? We see that we hear one story, we hear a story about the certainties. We're being told that it's quite certain that the lockdown works, vaccinations work, and that the NHS is a total problem and that we should help, etc. That's one story. But there's a backside of it. There's a backside of uncertainties around vaccinations, uncertainties about the lockdowns, there's uncertainties about could we have prevented this. There's so many uncertainties, but it's all created into certainties. And also it seems all to be transformed into a story about a horrific threat. Whereas actually when you look at the actual figures about, for instance, mortality figures, yes, there is something going on, but it's like a very bad seasonal flu when you just look at some of the figures. So where does this come from? Where did our public opinion get manipulated? How did it change from all those uncertainties into certainties? This was literally decided to be the strategy of how to manage the pandemic in February or March 2020. This was decided by the WHO Information Network for Epidemics, the so-called APWIN. They decided that the way how government should cope with the pandemic is by telling the people one story, one simple message, and telling that it's really horrible. So create a lot of existential threat and a lot of certainty. Tell, okay, these are the simple steps you can do. And consequently, what you see is that, for instance, the United Kingdom, they started a big campaign that's called Stop the Spread. But actually it's not the spread of the virus, it's the spread of what they call misinformation. And that Stop the Spread campaign has led to a censorship by YouTube, by Facebook, and by many other social media, and many other news outlets who refuse to give attention to criticasters. What we've even seen is that scientists who have been critical have been arrested or have been put into psychiatric wards. In the United Kingdom, there is also a so-called nudge unit, and that's the behavioral insight team. They've had a huge influence on the decisions from the government, but they are not independent researchers because they have direct connections with the industry. And they have been giving advice about how to manipulate, how to nudge people, how to make people believe what the government is saying. And also what we see is that the COVID bills that have been accepted by several governments, that they've literally undermined the legal status of independent scientists, where actually the final decisions are all made by governments, by ministers, and scientists cannot have a final vote. And consequently, we even see that in several countries like Denmark, Germany, UK, politicians have been pressuring scientists to change the data to give just one clear, certain message about how horrific this pandemic is. So what we see is what I call mind mafia. How our minds get manipulated deliberately by governments, by international organizations, and by our media. And undoubtedly, when I'm speaking about this, I think that quite a lot of the people who are now listening to me, they will be thinking, I thought that I could actually trust my government. But it's a myth that politics are neutral. Modern politicians, modern politics, is very much built on the idea that public opinions can be managed, and they even should be managed. It's seen as an ethical duty for the political elite, for the establishment, to control the people, to lead them into the way how they think is best for them. Like for instance, here on top you see a citation from Walter Lippmann, who is a very influential author at the beginning of the 20th century. He wrote, "The common interests very largely elude public opinion entirely and can be managed only by a specialized class." And also, totally at the bottom right, you see some words from Edward Bernays, the inventor of public relations. He said, "If we understand the mechanism and motives of the group mind, it's now possible to control and regiment the masses according to our will without them knowing it." And then those big influential people in the beginning of the 30s and 40s, they've really influenced modern politics and how modern politicians and economists, how they run the show. A very clear influence in the United Kingdom has been by Keith Joseph, the right hand of Margaret Thatcher. You can see a citation on the top right. For instance, he was saying, "Making the rich poorer does not make the poor richer, but it does make the state stronger. And it does increase the power of officials and politicians, power more menacing, more permanent and less useful than market power within the rule of law. Inequality of income can only be eliminated at the cost of freedom. The pursuit of income equality will turn this country into a totalitarian slum." So what you really see is that all those politicians and all those advisors of governments, what they're saying is like, we should have an elite, we should have a group of specialists who should make the decisions for the rest of the population. And actually, like, fuck all the type of democracy. And my apologies for the strong wording. But that's very much a core message that we're getting from them. And this is also a message that we now seem to be getting now during the pandemic, where it's a mind mafia in the line of those people like Lippmann and Bernays, where it's almost being seen as a moral necessity to control the people, because otherwise we're killing, because the virus can kill people. But this involves manipulation by politics, by corporations, by the media, by culture. So let's have a further critical think about it. How do politicians actually deal with those biological issues? This is called biopolitics. That's a term that was invented by Foucault. And Foucault was making a distinction between governmentality and self-governmentality. Foucault was saying in the past, governments were simply telling people what to do, and like a top-down. And that was still the case, I think, during the Spanish flu, picture of which you can see here on the slide. And Foucault was saying, well, that actually takes a lot of effort, a lot of time for governments, particularly to also manage and control people and to double check. It's much better if you can make people govern themselves. And that is what he calls self-governmentality. And he's saying governments can do that by, for instance, raising guilt, shame, responsibility. Because what we now see during the COVID-19 pandemic is that people are not going outside because they are afraid. They're afraid of getting the virus. They're afraid of spreading and giving the virus to the neighbor or someone else. They get so afraid that they start to control and to govern themselves. And it's this self-governmentality that is kind of doing like a internal mind fuck, as they say that. It's really getting there on our minds. And that is like creating a lot of stress for a lot of people. It's those feelings of shame, guilt, responsibility, anxieties. And that's precisely what governments want. Because governments want us to govern ourselves so that they do not need to govern us. But still they want us to behave how they want us to behave. And that is self-governmentality. And that is what's going on at this moment. And this is what a lot of critical thinkers are saying at this moment. One of them is the Italian philosopher Agamben, who's saying one of the big problems now during the pandemic is that the abstract concept of life becomes almost more important than the individual. Because we're not talking about individuals anymore. Like we don't really hear, for instance, at a press conference from Boris Johnson or President Trump, we don't hear them talk about John, my neighbor, and how he's coping with his COVID symptoms. No, what we hear is all the time an abstract concept of life, like saving lives. That's literally on the screen on each time that the British Prime Minister is on television. So the abstract concept of life becomes more important than the individual. And the individual can actually be sacrificed. As long as we save life in some way, abstract way. Yes, individuals can die, but that is almost irrelevant because we need to save life. And that comes like a holy thing in itself. And this is also what the government calls a state of exception. He's saying, yeah, usually governments would not be able to get away with something like this, like creating the self-governmentality or oppressing individuals, but they can do that because we are in a state of exception or we're in a shock. And in this extraordinary situation, governments can get away with almost anything. And people start to believe, yeah, this may be the best option. There is no alternative. The Tina doctrine. So what we see is that individuals can be sacrificed. Like in the Roman time, under Roman law, it was possible to exclude an individual from the community and actually to say that one individual could be killed for the sake and for the benefit of the community, of the society. The person was called the homo sacer. That individual could be killed because that's for the benefit of all. In a similar way, the side effects of the lockdown, like the 30, 40,000 people who have died because of the postponing of the so-called non-urgent appointments in the hospitals. Those people who died, they are just a side effect of saving that abstract concept of life. The full economy which is collapsing, the hundreds of thousands of people who have now started to go to the food banks, whereas they did not do that before. That's all a sacrifice that we need to do because there's the abstract concept of life which is sacred. Also, the philosopher Espito, also an Italian philosopher, he was saying it's almost like a psychological or a societal way to talk about immunity, humanitas. Because what you do to become immune in the traditional vaccinations is that you insert a little bit of death, a little bit of evil to get rid of the big evil. We need to start accepting a little bit of side effects of like how horrible, the horrific side effects of lockdown, for instance, or of the risks that the vaccination brings. Yeah, some people will die from the vaccination, but that's nothing when we compare that with the abstract concept of life that we can save. And this is very much where nowadays governments, they seem to have the total authoritarian right to make citizens suffer, to get ill, to die. And governments start to control people much more than ever before, according to the African philosopher Mbembe. And so what we start to see is this biopolitics, is this trend of biopolitics, where government starts to govern via actually reducing individual citizens. Each of us who have our own subjective experience, their lived experiences, we all get reduced to a simple function. We become like a variable in a bigger statistical function. And like if my life in itself is not meaningful anymore, what matters is life of society. It's saving lives, saving the NHS, not saving Joel Vos. So I also get reduced to a number. I get reduced to a potential bomb of virus and I can infect others. I'm not being seen in all my complexities. No, I get reduced to this materialistic variable in a statistical function from the government. So this is where we see where a lot of the complexities and totality of our lived experience get done injustice. Good examples of this is, for instance, in Germany, where they've started so-called COVID camps, where they start to lock up people who refuse to follow the lockdown rules. In the United States, there are certain schools where children who do not get vaccinated, they need to wear yellow badges that's saying that they've not been vaccinated. And also several countries, people need, actually they're now talking about vaccination passports. For instance, you would not be able to go to a restaurant, to the cinema, to any place if you've not had a vaccination and if you cannot prove that by showing a vaccination passport. What we start to see is a society with people who are included and people who get excluded, with homosaces. And it starts to remind us very much about the worst parts of history, of the Second World War, where people were excluded, when they had to wear similar yellow badges. And this is where some philosophers and some critical politicians in Germany have been saying, have we forgotten? Because we said never again. But aren't we doing now the same? And this is also about the freedom of speech and the right to protest. Under this so-called exceptional situation, the state of exception, under the shock doctrine, governments can get away with suppressing any critical voices. Whereas even like today, the day that I'm giving this presentation, actually Mark Zuckerberg has said that he doesn't really want to have any critical political debates on his Facebook platform anymore. So what we start to see is that anyone who is challenging the certainties that governments and scientists are promoting, that those dissenters, those rebels, that they actually get set aside. And what you can read here on the screen is actually the Universal Declaration of Human Rights. And that seems to start really undermined by governments. And it's being said, yeah, we have to do that. It's horrible. We don't want that. But we have to. Is to save that abstract concept of life. And yes, of course, we may disagree with this person who gets arrested here. And I actually don't know what this person has done to get arrested. But what is important is that we live in a democracy and that we keep that freedom. Because it's not only, I think, needed for a society and for science to be flourishing, that there is like a multiplicity of voices that can be heard. But it's also for our individual mental health, that we see the reality in all its complexities, in all his pluralities, and all the dynamics, and there are certainties, there's uncertainties, because that is life. And we should discuss all those different sides. But We're being told by the media a lot of information. And the way how the media actually speaks about alternative opinions, that influences us a lot. So what I've done is I've done some big systematic literature reviews and meta-analysis of all the research on COVID-19. And I found actually this formula where the misinformation that media give, in combination with exposure and trust, that will actually influence how we subjectively perceive the risks of COVID-19. Our own risks to get ill, but also our risks to actually transmit the risks to others. So this means, for instance, that we know that the media, approximately two-thirds of all the media information follows the government information, but one-third does not follow it. But actually, it's important how often do we get exposed to the information. Because the more often we get exposed to the same type of information or misinformation, the more it starts to influence us. And also if we trust the source, the people who are giving us this information, the more we start to believe it. So what we see is what influences our subjective risk perception is the combination of the media information, the exposure to that media information, and the trust that we have in this medium. And it's this risk perception that subsequently influences our mental health and also the risks we take and how we manage the risks. For instance, by wearing a mask or not wearing a mask, by socially distancing or not social distancing, by being in quarantine or not being in quarantine, by taking a vaccination or not taking a vaccination. It really has all been very much influenced by our subjective perception of the risks, which subsequently have been influenced by the media and by the information that governments give us. Okay, let's dive a little bit more into what is called fake news. I've already told you how it was the WHO who started saying with their AP-WIN committee that all the information about pandemic should be managed very, very tightly, and that there should only be given one clear message that this is a horrible virus, very transmissible, and people should therefore totally be afraid of it, and therefore people need to adhere to the guidelines. And this message from the WHO was taken over by many governments, such as the UK, who started the Stop the Spread campaign, which was actually about let's stop the spread of what they call misinformation. And this led to the censorship that we've seen on Facebook, YouTube, and other places. And also, it's not surprising that a lot of the media actually have been taking over the messages from the governments, particularly those media which have tight connections with governments. And like also the Murdoch empire in the United Kingdom. And also what we see is, I've already mentioned around how much we get exposed to the information of media. The more we get exposed to information, the more afraid we become. And the more afraid we become, the more actually we want to know more about it and the more attention we give it. So we start to get stuck in a vicious cycle of media addiction. Because media sells by creating fear, which makes us addicted, which makes us click on all the clickbites, and which make us go back to the same news source, because we become so afraid that we need to check it all the time. And it's rarely in history that people have been using the social platforms and all the media as much as nowadays. It's because we become addicted, because we're so afraid. And it's a direct consequence of the existential threat campaigns by governments, which were top-down directed by the WHO and the Stop the Spread campaign from the UK. But how do individuals cope with this? Like I've already mentioned, it's not as if people immediately copy-paste whatever governments are saying, because it's mainly like when you get exposed to it a lot, and also if you trust the media source, or if you trust the government, it's only then that starts to influence you. We also see that quite a lot of people, they have cognitive biases, they have logical fallacies. These are just arguments which don't really work from a logical perspective. But we also start to see that people often have this kind of emotional way of reasoning, where they say, yeah, I've heard the government say A, I must do A, but I actually believe myself that B is really the case. And quite often they tell their friends that C is the case, and the friends start to interpret that as D. So what you start to see is that there's a lot of reinterpretation going on. And why do people create this? Why do people create all their own interpretations of what governments are telling? I've done a lot of research on this, also now during COVID-19 in a big survey amongst more than 1,000 people worldwide. But it's like, again, the same findings as previous research that I've done in also more than 1,000 people, cancer patients worldwide. And what I found out is a very important reason why people start to interpret a situation in their own way, regardless of whatever the politicians, scientists, or media are saying. People start to interpret it in their own subjective way when people find it difficult to cope with uncertainty. When people really desperately want to have certainty, people start to create their own worldview. People start to create their own certainties. They're saying, yeah, okay, the governments are giving this amount of uncertainty, but hey, what I think is actually, I know for certain what is the case. So what you see is that tolerance or intolerance of uncertainty is a very important predictor. And also what we see is that when individuals are actually able to live a meaningful life, and particularly when individuals focus on the social or larger types of meanings in life. So that means that people are not necessarily focusing on only their own health, or when they're not only obsessed with their looks or with money. When people see the bigger perspective, the more people see those social and larger meanings in life, then actually people are also better able to cope with the information that they've been given. And the less they need to warp the reality of uncertainties, the more people can live with uncertainties. Because that is actually the main question that my full presentation is about. It's about the question, how can we cope with the uncertainties, and how can we learn to accept the uncertainties? And people who are very much aware for themselves what's meaningful for them in life, it's those individuals who are better able to cope with those uncertainties in life. And these individuals are also better able to cope with existential threats. Because like what I've mentioned is like the WHO AP-WIN committee literally said, okay, we need to create like an existential threat. Because if you make people afraid that they will possibly die themselves, or the neighbor or the mother or the grandmother will die, yes, make them afraid of that and people will behave. They will just follow the guidelines. That was the reasoning. That's literally what some of the reports are telling from the WHO. But research does not show this. Because that's precisely what I was saying. It's like people have cognitive biases, those logical fallacies, and people have their own emotional reasoning. They have their own interpretations. So that existential threat, people cope with that often in many different ways. There's a lot of research actually that shows when you existentially threaten people, the first thing they do is deny. They simply deny that there's an existential threat. They're saying, no, it's not going on. Maybe going on for another person, but not for me, not in my life. They diminish the actual threat. They put attention to something else. They get addicted to Netflix and to Amazon Prime television. But actually, so that's only like a first strategy. A second strategy is actually that where you threaten people existentially, where you tell, okay, you can die or others can die, people actually start to defend themselves. People start to almost like retract and go into their own shell or into, they almost create like a bunker around them with very solid, thick walls so that they cannot be attacked by any of those existential threats. And examples of that is people become more conservative, which means that people try to literally conserve what they have. They become more racist. They become more nationalistic. People start to think only about their friends and their own families. They start to defend their own values even more than ever. They become less open for new information. So what you see is that this strategy, this international communication strategy of coping with the pandemic, This idea to threaten people existentially is possibly counterproductive because it actually triggers those existential defense mechanisms which make people listen less to what's being told. One of the consequences of all this is that people start to build conspiracy theories. And I have to say that I always make a distinction between a conspiracy theory with a small letter and conspiracy theory with a big letter. Because it's very easy to use, or to say that someone is conspiracy theories. That's a very easy straw man. It's easy to, for instance, say about my presentation, yeah, well, come on. Whatever you're telling, it's all nonsense. You're just a conspiracy theorist. And with such an argument, you just put it totally aside. You even give not a second attention to it. Well, that is a strawman argument. It's therefore important to make a distinction between conspiracy theorists, or what I actually call a conspiracy reality, but with small letters. Conspiracy realists, these are individuals who ask critical questions, who want to look at what's reality really, what's going on, but without making big logical jumps and becoming illogical, really looking at what is science really telling. And of course, that differs from the big conspiracy theories where a lot of different things are brought together. No, the starting point for conspiracy realists is much more reality and research evidence, and often focused and led by scientists. Okay, so I've been talking about the impact actually that all those communication strategies have had on people and how governments and scientists, how they have been trying to influence our perception of the risks. And I've already mentioned that the more you are at risk of getting the virus or spreading it, of course, the more stressed out you will be. That's logical. And that's also what we see in a lot of research. So when I've done a systematic review of all the studies on the mental health impact of COVID-19, I found that 1 in 2 healthcare workers, they report severe mental health problems, such as an acute or a post-traumatic stress disorder, anxiety or depression. And 1 in 3 individuals in the general population, they mention similar mental health problems. And these numbers are actually bigger than during previous pandemics like the first SARS pandemic. And it's also important to mention the so-called long haulers. Long haulers are the individuals who have been diagnosed with COVID-19, but whose symptoms have not disappeared, even not a year later. And often what you see is that there may be some issues going on in their immune system. There are many hypotheses about that. But often it can like an interaction effect with some psychological factors as well. And this is also what's really important to mention is that there's a vicious cycle because when you're stressed, it actually makes you more susceptible for infection because stress reduces the immune system functioning. So it's more likely when you're stressed out that you will get COVID. And that's also what we've seen where individuals who experience a lot of stress in their life are actually more likely to get severe COVID. And that's where you get this vicious cycle. And then what I did is I also asked in my studies, like, why do those individuals experience those mental health problems? And what I found when I was analyzing all those previous studies on the mental health impact of COVID, what I found is, in the first place, the larger your risk for getting infected and the larger risk is to transmit COVID-19, the larger your stress is. Logical, I would say. But it also has to do about politics, particularly in those mental health care workers. Because what we see is that mental health care workers, they say that they worry about the lack of PPE. They struggle with a lack of equipment. A lot, they don't have enough ventilators, not enough beds, not enough colleagues. And actually, they also struggle with the organizational mess, chaos, and by the political oppression, where they are, for instance, not allowed to speak out about what's going on. So they're saying actually that stress is caused a lot by the politics. And also we see, of course, that there have been several vulnerable subgroups who actually are literally at a larger risk for COVID and consequently also feel more stressed and experience more mental health problems. But we also see that the quarantine and the lockdown has immediate side effects, which is understandable because when you have to stay at home suddenly, of course you will be more stressed out. It's very likely. And also when you are at the risk of losing your job, when you are struggling financially, of course you get stressed. You have problems with housing, possibly relationship problems where because you have to live, for instance, like with a partner who is abusing you, but also like a lack of social connections, loneliness, or lack of physical activities, and also that mental health care, but also physical health care appointments get missed. So it's this combination of factors where quarantine and lockdowns can have a huge impact on mental health. Okay, until now I've been talking about a lot of those different aspects of the COVID-19 pandemic, all separately from each other. But let's try to have like almost like an overview of it. What's the overall pattern that starts to emerge when we see all those dots, all those different conclusions, and we start to connect all those different points together with lines? What kind of figure starts to become visible? This is what I call the corona life syndrome. And I've called the corona life syndrome after the Stockholm Syndrome. The Stockholm Syndrome, that's a pseudo psychological diagnosis for individuals who get actually taken hostage. And they start to identify themselves with the hostage, like during this raid in a bank in Stockholm. The people who were taken hostage started to actually defend their hostage takers when they were liberated. Because they started to identify themselves with the hostage takers, even though the hostage takers have been very violent towards them. In a similar way, now during the COVID-19 pandemic, people start to identify themselves with the governments and the scientists who are imposing their uncertainties onto them. People start to actually live in this corona life syndrome. Let me summarize this corona life syndrome. And I know this is a very full table with a lot of details, but a lot of it is just summarizing what I've already said before. The status of the corona life syndrome, it's very much about actually the need for certainty that a lot of people seem to be having. Whereas like people, we're not talking about real certainties. We're talking about symbolic and imagined control of symbolic and imagined certainties. Like, for instance, what I've spoken about, yes, it would be great if the vaccination lockdowns would work in the way we would hope them that they would work. But there are a lot of uncertainties actually around them. And they are symbols as much as they are maybe a reality. And what is this corona life syndrome really about? It's mainly reducing individuals to this too materialistic being. Like we've become like only like potential time bombs of viruses, where the individual subjectivity gets pushed aside. How we experience a lockdown doesn't matter because it's the abstract concept of life that needs to be saved. But me as an individual, with my own lived experiences, that's not relevant because how people cope with this, how governments talk about me, is in a functionalistic way. I've become a materialistic variable in a larger statistical function from the scientists and the government. And where this all happens is that there's external control, the authoritarianism with all the guidelines from governments, but also I start to control myself. I start to feel guilty. I start to feel ashamed. I start to feel responsible. I start to feel like to be anxious, to be oppressed. This is biopolitics. And when this all happens is that our risk perceptions, how we see our own risks, our mental health and behavior, they seem all to be shaped over time by the influences from the government, the scientists, media, and the pharmaceutical industry. Or actually, critical thinking is actively destimulated. And this is done by a small elite of governmental decision makers and scientists who make decisions for us, the citizens. And they decide what we need to think, feel, and do. So our freedom becomes a negative freedom. Our society becomes fundamentally unequal and creates helplessness for the average citizen. And this is all done by triggering the existential angst and the existential defense mechanisms, by threatening us actually and telling how likely it is that we will die or others will die. By that, it's on this existential level that we get triggered and that we start to identify ourselves with our hostage takers. And this is where mental health problems start, where the quality of life gets low and our life satisfaction gets low. But there are alternatives. Let's start with one simple slide in which I summarize very quickly what I see, what research is telling, what we can do. So first, let's look at some what I would call some quick fix solutions. What can we do ourselves in our daily life to cope with the pandemic? How can we become resilient here and now? In the first place, I've already mentioned how exposing ourselves a lot to media can have a huge impact on how we feel at risk and also about how afraid we feel about our mental health. So, and we can get addicted to media. So, yes, of course, we need to be informed, but we need to limit our exposure to it. You don't need to check 10 or 20 different websites or media sources. It's important you select in a very critical way the media you can trust. Also, second, it's important to have a structure in your daily lives, particularly if you've lost your job or you're studying and you don't have the usual structures in your daily life. Literally try to get up each day around the same time and make sure that each day you have some activities planned in your diary, something to look forward to, some highlights, some fun. And also be physically active, preferably go outside into nature, have literally some fresh air, open your windows. But at the same time, if that's not possible, be physically active at home. Do exercise. Just have a look up on YouTube for any videos on physical exercise you can do during the pandemic. Also be socially connected. Call your friends. Use Zoom, use Skype, use your emails, write letters. Be in touch. Even though you cannot meet them face to face. Of course, we're all missing the physical hugs. But be connected. That's crucial. Being alone, being lonely, it is one of the worst things to feel. Be connected and be active, be proactive in making appointments. And really crucial is make sure that you have enough activities in your diary that are meaningful. Focus on the things that really, really matter to you. Because during the pandemic, when actually everyday life can become very boring, very dull, and also, at the same time, when we feel very much existentially threatened and we start to ask ourselves, why should I live? What are we doing this all for? Because we get so obsessed by all the existential threats. Then it's crucial to start asking ourselves, what is really truly important in my life? There are many different answers people can give to that. There's not one overall answer for that. You need to find it out for yourself. But focus on activities that are meaningful to you. And remind yourself of those meanings in your life. For instance, what I always say, try to transform your house into your home. Because a home is full with meaning. So for instance, put up some pictures, put some reminders from previous holidays, or remind yourself of some friends by putting up pictures next to your bed. Anything like that. Buy yourself some flowers. Anything that is meaningful and that can remind you of your meaning, literally in your physical surroundings of your house. On the long term, let's prevent actually that all those problems are starting to emerge. And that's by being critical and follow the scientific evidence. Like in a way how I've been doing that today, where I'm saying, there's not only the certainties that we're being told by governments and by scientists, there's also uncertainties. Just be logical. And also, when you are confronted with reality, that does not only give certainties, and that's not always comfortable. Yes, learn to tolerate those uncertainties, learn to tolerate those anxieties. Yes, life and reality are not always as beautiful and as nice as we would love them to be. Yes. That's life. Think back to earlier moments in your life when you were confronted with uncertainties or fears. How did you deal with that? How did you get through those periods? Could you use a similar coping style again? So it's not the uncertainty or the anxiety that will kill you. It is actually the virus that could, or possibly like actually the side effects of lockdown. But it's not the uncertainties or the anxieties. So learn to sit with them because it's normal that you feel uncertain. It's normal that you feel anxious. There's nothing to worry about. And talk with friends, people, or even a professional about it because there's nothing to be ashamed about. And particularly, again, crucial is to really be aware of meaning in your life. So on a larger scale, when we start to talk about the corona life syndrome, you saw the table beforehand, the previous table already with very tiny fonts, and these fonts are even smaller. But I really wanted to show that all on one slide because I want to show that the alternative to a corona life syndrome or to what some sociologists have called the world risk society, the alternative is a world resilience society. Because sociologists are saying, well, the reality is actually that we live in a world full of risks. And the COVID-19 is just the latest risk. But before that, there have been so many risks that we live with. The risk everywhere. Like when you cross the street, you can be hit by a car. There can be like a comet that suddenly crashes into Earth and we're all dead. That's all possible. These are realistic risks. Okay, some are really tiny and others are bigger, but they are real risks. So we live in a world risk society. What we try to do is we try to really oppress all reminders of those risks. We try to use our existential defense mechanisms and to say, no, 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 that's not happening. Because our governments are in control, our scientists are in control. Let's just have a lockdown and let's just have vaccination and all those risks are gone. But this is what the sociologists are saying. Sociologists like Ulrich Beck are saying, no, we live in a world risk society, but there are risks which cannot always be totally managed and controlled. That's unfortunately the reality. What we need to do is that do not get obsessed with those risks anymore, and that we transform the world risk society into a world resilient society. So I'll go over that. By that I mean that we transform our need for certainty in a symbolic and imagined way. We start to look at the complexity and the dynamics of reality. We start to realize that reality, that life, that society is full of certainties and uncertainties. And that is just what it is. And also that we do not only look at human beings and as a fellow human beings merely as potential time bombs, only as like biomedical machines. No, we are not. We are all human beings where each of us is worth living. Each individual life is worth saving. We should not be playing those number games. Because what really matters is not only those materialistic types of meaning, but it's like actually like holistic focus. So many different types of meanings, individuals who matter. And these are also the social and larger types of meanings that matter. And these are topics like freedom, democracy, ethics, justice, spirituality, religion. For the sake of all the social and larger types of meanings, we cannot sacrifice individuals for those abstract concepts like life. No, we need to balance that. We need to really be aware of our social and larger meanings in life. What really matters? What is our compass now during the pandemic? Do we really want to be a society where we can give up our freedom for the sake of materialistic control, which is actually mainly an illusion because we will never have that 100% control. So we really need to have the bigger perspective. And how we can develop that is not by being functionalistic, not by looking at ourselves and others as mere abstract variables in a statistical function. No, feel, listen to your gut feeling, be critically intuitive. Or to say that with a more scientific term, use your phenomenological processes, your phenomenological intuition. That means that you're critical, and that you're not only using your brain, but you use your full body, what it's telling you. And even Listen to any negative feelings. Listen to when you don't feel at ease. Listen to your anxieties and uncertainties because they're telling you something. Uncertainties and anxieties, they have a reason. They tell you something. They try to teach you something. They try to teach you that life is more complex and more dynamic than we're being told. Listen to them. Listen to what's really underlying those anxieties. Listen to what's underlying those uncertainties. What does it tell about life, about our society? And so this also means that we should possibly not be trying to control everything because a lot of life cannot be totally controlled. Yes, we can hope for it, possibly, that we can control the virus, but most likely there will be viruses, there will be sicknesses, there will be death. It's part, unfortunately, of human nature or of the human condition. So let's start instead a critical, empathic societal dialogue where we acknowledge the risks and uncertainties that all of us are facing. And instead of having a small group, a small elite, telling us how to think, feel, and do and behave, instead of that, educate people from a young age onwards about how do we cope with risks? How do we cope with viruses and pandemics? How can we critically interpret actually scientists and governments? And how can we critically think and behave ourselves and be responsible? So that is very much about education of the young people, fighting corruption and nepotism within governments, within the academic world, within the big pharma, really stop all the lobbying and stimulate independent research. And so this also means replacing the small elite of governmental decision makers or those people in power with a lot of money. Instead of create a true democracy where freedom really becomes valuable again, where the voice of individual citizens are accepted and not being censored. And build trust in the people and empower individuals who need because when they are being the victim of the system. And build actively resilience and critical thinking and a space for diversity of voices. And this would help people to create a positive freedom, equality, and empowerment. And why? That's because of the reality. Reality, the existential reality, that's complex, that's full of certainties, that's full of uncertainties, that's risks, that's not risks, that's unknowns, uncertainties. There's so much going on. And it's that complexity, that totality, that we try to have as a starting point. Instead of this existential angst, instead of all those illusions and deceptions that we try to follow and believe in. Because when we learn to live with reality, with how reality is and all its complexities and dynamics, when we learn to live with that, actually that will improve our mental well-being, our quality of life, and our life satisfaction. And how can we get here? How can we transform the world risk society into a world resilient society? We can do that in four ways. We can first try to find alternatives within the system. We can try to, for instance, within our own house, create our own communities without totally changing the system, but having our own groups of friends and families. But also find alternatives possibly outside the system and possibly go towards like live in villages in the countryside in other countries or in like squats. Create your own systems, your own communities. Some people may also want to fight the system, fight the corruption, fight the nepotism, fight the authoritarianism. And some people, also like myself, like today, try to go beyond the system by creating utopian visions that can give hope and can stimulate hopefully. So finally, some words from Michael Steger. And these are some of his words that he wrote in response to my book that I've written about the economics of meaning in life. Michael Steger said the following: the alternative, creating social systems that support and celebrate the highest human aspirations for meaningful life, is inspiring and, as thousands of research studies show, not only practical, not only necessary, but also glorious. Because we can have this glorious society where we can live together and where we can overcome this pandemic and build a resilient society and resilient lives, so that we can cope with any future pandemics. So thank you very much for listening. This presentation is very much also in the line of a lot of the other work that we're doing, because I'm part of the International Meaning Events and Community, IMEC, which you can find on meaning.org.uk. With our events, you'll find inspiration and a community for living a meaningful life, because everybody deserves a meaningful life. And we organize conferences, social support groups, art and music events, training and workshops, publications, and we have a very inspiring community. And for instance, in May, on the 8th and 9th of May 2021, we organize a festival of hope and despair, because we believe it's important to mention both sides of the pandemic. Not only the hopes, but also the despair. Both need a space. And you can also speak there, actually prepare any workshop or lecture if you like, or just come as a participant. It's really inspiring. So you can find more about it on meaning.org.uk. This presentation is built on my book, The Psychology of COVID-19, Building Resilience for Future Pandemics. This book has been published with Sage Swift and is available in all large bookstores, at least online you'll be able to find them. This presentation has also been inspired by my other book, which came out in the summer of 2020 and the height of the pandemic. This book is called The Economics of Meaning in Life, From Capitalist Life Syndrome to Meaning-Oriented Society. And in this book, I've developed the idea of the Corona Life Syndrome. And this may be a relevant book if you really want to know a lot about all the statistics and all the facts, the references behind what I've been speaking in this presentation. So thank you very much for listening to this presentation. And if you want to find out more, again, you can look at meaning.org.uk or my personal website, joelvos.com. And you can find there more information on the different books that I've written, and also about a future book that's called Facing COVID-19 and Beyond, which is actually a book based on a conference, on the IMEC conference in 2020. So thank you very much. And I really hope that you will develop some resilience for future pandemics.